about everybody's favorite topic. Should you give your breastfeeding baby a pacifier? I look all nice and have my hair down, but it's like wearing a blanket, so we can't be doing that. Anyways, I know I've talked about nipple confusion before in relation to bottles and flow. And it's no secret that I don't really buy into the whole nipple confusion thing. I have the same opinion for pacifier use. The recommendation is to not give your breastfeeding baby a pacifier for about 2 weeks until your milk is well established. Reasoning for this is that giving your baby a pacifier can mask some of your hunger cues. So if you are establishing latch and establishing your milk supply in those first 2 weeks, you oftentimes are trying to feed on demand so that the milk production matches the baby's needs. If the baby cries and you give them a pacifier, then that could mask the symptom of hunger. As a board certified lactation consultant and a registered nurse certified in maternal newborn nursing, I have a different opinion. My recommendation to my patients is that they give it a couple days to get the latch established. Now you can go as long as you want without giving your baby a pacifier, but I need you to remember in this entire thing that your sleep and your mental health are very important. Arguably, you are the most important part in this breastfeeding adventure. It doesn't do anybody any good if nobody is resting. If giving your baby a pacifier is what gets you guys rest, then give it. Grand scheme of things, giving your baby that pacifier is not going to derail your entire breastfeeding journey. Now, with all of that being said, there are some things that you want to look out for when you're choosing a pacifier. You want to choose a pacifier that mimics the shape of your natural nipple. A natural, comfortable latch, the nipple shape should stay nice and rounded. It should not be flattened. So choosing a pacifier like this with a nice rounded tip is what you should choose in order to encourage that same oral pattern while the baby is sucking on the pacifier. You do not want to choose something like this with a smoosh tip so that your baby is not learning the oral pattern of smushing the tip of the nipple. You're never going to find a pacifier that supports a deep latch, and you really don't need that. Baby is going to use this pacifier as comfort. After pacifier use, when baby does transition back to the breast, you just want to encourage them to get a deeper latch, so make a bigger sandwich, make sure baby's latching on lower lip and then top lip in order to get that nice deep latch. Biggest thing here is do what feels right for you and your infant, and Mommy Milkmaid is always here to support you.